Hearing Conservation Program. Hearing loss. We take our hearing for granted. We don't think about being able to hear the next sound, but hearing is an important part of the quality of our life. Continued exposure to noise above 85 decibels can result in permanent hearing loss. Anatomy of the ear. There's the outer ear, the middle ear, and the inner ear. The outer ear consists of the auricle or pinna, which collects sound. The middle ear has the tympanic membrane or eardrum and conducts sound by vibrating. Ossicles or tiny bones, the malleus, incus, and stapes, is like a lever system to conduct sound. The eustachian tube equalizes air pressure in the middle ear. The inner ear is fluid-filled. The cochlea is snail-shaped and contains hair cells. How we hear sounds. Sound waves enter the ear canal. The eardrum vibrations pass along tiny bones. Tiny hair-like cells flow back and forth. The auditory nerve sends signals that are registered as sound to the brain. Types of hearing loss. There's conductive hearing loss and sensorineural hearing loss. Conductive hearing loss consists of canal blockage, ruptures, or infections. Sensorineural hearing loss is more like presbycusis, which is age-related. Head injuries, ototoxic medication can cause it, various diseases, and noise-related hearing loss. Noise-related hearing loss is a documented pattern of damage to the inner ear when a person is exposed to excessive noise over an extended period of time. How hearing is damaged. The most common way of losing hearing is through gradual damage to the delicate hair-like cells. Normal sounds cause the cells to move back and forth like grass in a gentle breeze. Loud noise causes the hair to lie flat. Once the noise stops, the hairs spring back, much the way a trampled field of grass will slowly spring back. But eventually, over a long period of time of loud noise exposure, the tiny hair-like cells no longer spring back, and one day they're too damaged to even return to their normal position at all. And once hearing is damaged, it cannot be repaired or replaced. Some signs of hearing loss. Difficulty hearing people speak, inability to hear certain high-pitched or soft sounds, noise or ringing in the ears, getting complaints that the radio or TV volume is too high. Types of noise. There's pitch or frequency and loudness. Pitch or frequency is measured in hertz. Loudness is measured in decibels with a sound level meter. Pitch or frequency can refer to the high pitch being more like a children's voice or violins playing. The low pitch is more like a bass drum or baritone voice. Below are some examples of loudness in everyday sounds. A whisper is like 10 decibels. Sander, 85 decibels. A sporting event, 100 decibels. Motorcycle riding, 112. Concerts, 125. And the shooting range, 130 decibels. How does hearing loss impact the worker? It can interfere with communication, cause fatigue, causes distractions, or can be irritating if you have ringing in your ears. It reduces morale or efficiency, and all of these factors can cause workplace accidents. Noise monitoring. The first step of a hearing conservation program is to conduct a noise level monitoring survey to determine what types of noise employees are exposed to. Employees or their representatives are provided the opportunity to observe any noise monitoring that is conducted. A typical noise monitoring strategy will determine if noise hazards exist, identify employees who are impacted, and help prioritize noise control efforts. Affected employees. All employees exposed to 85 decibels or more for an 8-hour time-weighted average are considered affected employees and must participate in this training program. Inclusion in the Hearing Conservation Program means that you are impacted by the requirements of this program. Hearing tests. Hearing or audiometric tests are offered to all employees who are included in the Hearing Conservation Program. The hearing tests are conducted by a qualified medical provider who will also evaluate the hearing test results. The first test is the baseline test, and that must be conducted within an employee's first 6 months of inclusion in the hearing conservation program. Follow-up tests are conducted annually. Standard threshold shift. Hearing tests are evaluated to determine if any hearing loss has occurred. Standard threshold shift, or an STS, is a change in hearing relative to the baseline test of an average of 10 decibels or more at 2,000 Hz, 3,000 Hz, and 4,000 Hz in either ear. When you have an STS, you must be notified within 21 days. Sometimes revised hearing protection is required, and also sometimes further medical evaluation is required. Noise reduction efforts. There are different kinds of noise reduction efforts. Engineering controls, which is reducing noise at the source, interruption of the noise path, reducing reverberation, and structural vibration. Or administrative controls, operating noisy equipment on second or third shifts, and rotating employees through high noise areas. Hearing protection devices. These consist of earplugs, canal caps, and earmuffs. There are many different styles and brands of earplugs, but they're all very similar. Canal caps are useful for employees who are exposed to loud noise for short periods of time, or someone who has to walk through a high noise area to get from one department to another. Earmuffs are generally used as a supplemental protection from noise. Headphones on portable radios do not count as a hearing protection device. The purpose of hearing protection is to reduce your exposure to noise. The exposure must be reduced by the hearing protection device you wear to at least an 8-hour time-weighted average of 90 decibels. If you have suffered hearing loss and are classified as having experienced a standard threshold shift, you must have hearing protection that reduces exposure to at least an 8-hour time-weighted average of 85 decibels. Each hearing protection device is rated to reduce noise exposure by a certain number of decibels. This is called a noise reduction ratio, or NRR. However, the NRR is a laboratory result. The real-world NRR is significantly less because of inadequate fit and application from most employees. For earplugs, assume the real-world NRR is less than 1/3 of the NRR listed on the package. Typically, we take the listed on the package NRR minus 7 and divide in half, and that's your estimated attenuation. Hearing protection use. Voluntary use is that for people exposed to an 8-hour time-weighted average of 85 decibels, they can choose to wear hearing protection. Mandatory use is if you're exposed to an 8-hour time-weighted average of 90 decibels or more. Training. Training is required annually, and topics must include how noise impacts hearing, hearing protection devices, and hearing tests. Record keeping. Management is required to keep records of noise monitoring results, hearing test results, job assignments and noise exposure history, hearing protection devices used, and all of these records must be accessible. Employee responsibility. Understanding the need for hearing protection. Wear your hearing protection and seek replacements. Encourage coworkers to wear hearing protection devices and communicate all problems to your supervisor. Here are some hearing conservation resources: the Council for Accreditation in Hearing Conservation, the Deep South Center for Occupational Health and Safety, NASA, National Institute for Occupational Safety and Health, the National Hearing Conservation Association. Thank you so much for taking the time to listen to this video. Please wear your hearing protection and protect your hearing. Thank you.